Vanakkam, good morning. In this video, we are going to discuss about the ventilation perfusion ratio or VQ ratio. V for ventilation, Q for perfusion ratio. Ventilation perfusion ratio is the important short notes from the respiratory physiology. Normal alveolar ventilation is the 4 liter per minute. Tidal volume is the 500 ml. In the tidal volume, 150 ml is the dead space volume, 350 ml is the used for the gas exchange. 350 ml multiplied by the respiratory rate average is the 4 liter per minute. So the pulmonary blood flow is the 5 liter per minute. That is the cardiac output. So ventilation is the 4 liter per minute. Pulmonary blood flow is the 5 liter per minute. Average normal ventilation perfusion ratio is the 0.8. So it is the average ventilation perfusion ratio. So it is not all the place of the lung. The apex is different ventilation perfusion ratio. Base is the different ventilation perfusion ratio. In the middle of the lung, it may be 0.8. So we will discuss in the next slides. Ventilation is 4 liter per minute. This is the schematic lung. This is apex. This is base. From apex to base, ventilation is gradually increases because the apex contains larger alveoli compared to the base. It contains smaller alveoli. Large to small, gradually sizes decreases. Apex large alveoli, base small alveoli. The apex is large alveoli, therefore cannot increase the size furthermore during inspiration. But basal alveoli is small size, can more stretchability. It can increases the size. So ventilation is more in basal region compared to the apex region. Complaints also more in the base of the lung due to the small alveoli. Perfusion of lung. Lung receives the blood supply through pulmonary artery from the right ventricle. The blood flow from the apex to basal region. The apex base having the more blood flow compared to the apex due to the gravity and the apex region contains a larger alveoli, therefore it compresses the blood vessels compared to the basal region. Basal region contains the small blood vessels, small alveoli. It will not compress the blood vessels. So each alveoli having surrounded by the many capillaries. Perfusion also more in the basal region. So apex to base is perfusion is increase more. Large alveoli compresses the vessel. Ventilation perfusion ratio. In the graph, this part is the apex, this part is the base. Ventilation from the apex to base gradually increases, and perfusion from apex to base straightly increases. It increases very much compared to the ventilation. So normal ventilation perfusion at the middle of the lung is 0.8. At the apex, ventilation is from the apex to base increases. Perfusion also apex to base is increases. In the apex region, both ventilation perfusion is low, but at the apex level, ventilation compared to the perfusion is more. Ventilation is compared to the perfusion is more. So on the apex region, ventilation perfusion ratio is 3.6. The basal region, perfusion is very much high compared to the ventilation ratio. So ventilation perfusion ratio is decreases 0.06 at the basal region because base contains a more blood flow compared to the ventilation. Decrease ventilation perfusion ratio mainly occur during the foreign body obstruction of the bronchi and some tumor obstruct the bronchi. So it decreases the ventilation in the alveoli, but the perfusion in the blood vessel is normal. It mainly occur in the bronchial obstructions. It decreases the ventilation. Same time, here alveolar PCO2 is increased because the gas exchange not occur. So alveolar PCO2 increase, alveolar PO2 is decrease. Increase ventilation perfusion ratio. So increased ventilation perfusion ratio occur in the vascular obstruction due to the emboli or thrombus. So here decreased perfusion, but ventilation is normal. Obstructs the perfusion. Therefore, increases the ventilation perfusion ratio. Ventilation is normal, perfusion is decreased. Therefore, increase ventilation perfusion ratio. Alveolar PCO2 is decreased very much in these conditions. Alveolar PO2 is increased during the obstruction of the blood vessels. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.